This lecture is going to examine the drugs of abuse. I want you to remember the drug scheduling. We basically schedule drugs so that we have kind of an idea as to the safetiness or the clinical usefulness of these drugs. Drugs that are classified as Schedule 1 include the major drugs that are of little to no clinical use at all. So these drugs all have a high potential for abuse, and we don't really have any bona fide use for them except recreational use, which in almost every instance is illegal. So MDA, ecstasy, you can probably cross marijuana off this list in most states, LSD, heroin. Schedule 2 include drugs that have a high potential for abuse but have some accepted clinical use. So opium, morphine, cocaine, PCP, yes, these drugs do have some clinical use, but recreational use and use outside of a medical clinic, of course, would be not very conducive to the patient's health, of course. Schedule 3 drugs have the potential for abuse, but much lower than the previous categories. These are drugs that also have medical use. Anabolic steroids in the appropriate patient population, ketamine as an anesthetic, codeine combined with other products such as Tylenol or ibuprofen. These drugs are all kind of your Class 3, Schedule 3 drugs. Your Class 4 drugs are drugs with relatively low potential for abuse, but the side effect profile or the safety of these drugs would definitely lead us to control them a little bit better. Benzodiazepines would be a good example of this. And then, of course, Schedule 5 drugs have a relatively low potential for abuse. They've got relatively good safety profile. However, abuse of these drugs might lead to physical or psychological dependence. A good example would be the over-the-counter opioid preparations of antidiarrheal and antitussive medications. These, of course, can be abused, but they're formulated with other drugs that make their abuse basically minimal to non-existent. The scheduling has been out since the 1970s. It was really the political agenda of the then President Nixon. And so, of course, it's just a nice kind of summary chart. The Controlled Substance Act was put into effect around 1970. And basically, we had a nice comprehensive list of drugs that could be abused. And of course, the ones that are clinically useful are centered around here. Now, one thing to keep in mind is that the route of administration matters. And so lots of these drugs can have a varying safety profile as well as a varying pharmacokinetic profile based on how they were administered. And these are all the crazy ways people have come up with to get these drugs into their system. Some of them can be injected with an IV, some of them can be turned into a powder and inhaled. Some of the liquid or even dry powder material can be snorted or snuffed. And of course, the old-fashioned ways you can just swallow the pill. All this leads to varying effects on the onset, the offset, and of course the duration of action. So a lot of the drugs that can be abused can be further kind of classified into the sedative hypnotics, which are some drug classes we've already talked about, barbiturates and benzodiazepines. In this lecture, we're going to revisit them briefly, but we'll also talk about alcohol. The narcotics, drugs that we've already talked about in other blocks and other cases, opium, morphine, heroin, and codeine. We'll talk about these briefly again. The dissociative drugs, including PCP, ketamine, can and often are abused. The hallucinogens, LSD, mescaline, and ecstasy would be ones that would fall under that category. And the stimulants, caffeine, nicotine, cocaine, meth, and regular amphetamine all kind of fall into this stimulant category.